Greater Sydney's original lockdown was supposed to end in just a few hours. Instead, more than 5 million people are tonight living under even tougher rules. The Premier says she had no other choice if the city is to have any chance of controlling COVID. 44 new infections have been detected. That's another record for this outbreak. More than half those cases were infectious in the community, and this virus is indiscriminate. 10 patients are in intensive care. One of them is in their 20s. Among the new tighter restrictions, a limit on how far you could travel from home and rules on just who can go shopping. We have a team of reporters in all three council areas that officials are most worried about. Jonathan Hare leads tonight's coverage.
Gladys Berejiklian has walked this path every day of lockdown. Never has she brought news so grim.
The message I'm delivering today is quite shocking for a lot of people, but I need everybody to be shocked.
New South Wales is at war with an invisible enemy and the state's losing. Another 44 infections have been found.
It's very scary because we never know, it could get worse and worse every day.
It's growing, but we don't want it to grow any further.
The majority of new cases were infectious while in the community. With so many people interacting, the numbers could soar further.
Unless there's a dramatic turnaround in the numbers, I can't see how we'd be in a position to ease restrictions by next Friday.
It's been a long journey in the fight against COVID, but we cannot stumble over this hurdle.
And so restrictions have been tightened again. Only 2 people from different households can gather outdoors for exercise and recreation. They must stay within 10 kilometres of home, and carpooling isn't allowed. Just one person can leave the house for shopping. Browsing is banned. From Sunday, funerals will be capped at 10 mourners.
We cannot let this virus take further foothold and lead to an exponential rise in cases.
Josie Bryce-Smith is one of many people fighting the virus. She's in her 40s, fit and healthy, but got caught up in the Bondi cluster.
So I've got a really bad headache now. I've got a lot of body aches and I've got a very bad chesty cough. My throat is incredibly sore and I completely lost my sense of taste and smell.
Her 14-year-old daughter is also positive. She narrowly avoided hospitalisation as her temperature raged.
I just don't think that people understand, and I probably didn't understand, to be fair, until I got it and saw how quickly it's spread within the people that have got it. And 2 people that we know are in intensive care on respirators.
Still, more and more venues are the subject of health alerts.
So at the moment, we have over 14,000 close contacts. Now, yesterday it was 7,000.
Including 2,000 shoppers at the busy IKEA in Tempe. Anyone there on Tuesday has been ordered into 2 weeks isolation. The Premier has also shut down speculation that at this time New South Wales could just let the virus spread. She says only 9% of the population is fully vaccinated, and if COVID was allowed to rip, it would see thousands in hospital and many deaths.
New South Wales, and in fact no state or nation or any country on the planet, can live with the Delta variant when our vaccination rates are so low.
So until there are more jabs in arms and 2 doses, not just 1, there's no living with the virus here, just living in lockdown. Jonathan Hare, ABC News, Sydney.
There's been a huge police presence in the city's southwest. Extra officers have been deployed there to make sure the rules of this lockdown are being followed. Mark Reddy is in Liverpool tonight. Mark, how are police describing this operation?
Well, Jez, police say this operation has been a huge success, and certainly the rain helped, but also the help of translators. Take a look at this shopping mall. It is completely empty, and that's exactly how officers want to keep it over the next few days. 87 businesses were subject to compliance checks, 51 warnings were handed out, but only 9 people were fined, and it was mainly for not wearing masks. No one was arrested or charged during this 8-hour operation, but there was an ugly incident beforehand. By all accounts, Patience is wearing thin. When police asked this man to pull his mask up to cover his nose, tempers flared. The 20-year-old was arrested and charged, accused of spitting at officers.
We know it is a very difficult time, but the issuing of a notice or getting in a confrontation with police is the very last thing that we want.
A surge in cases in Sydney's southwest is being met with a surge in force.
The focus always moves to where the virus is moving, and it doesn't matter what that postcode is.
I think it is unfortunate, and I'd rather see a health response than a police response.
On horseback and on foot, more than 100 extra officers were deployed to the region. Their main target, shopping centres. At Westfield, Liverpool, police swarmed the food court. Pandemic patrols were also carried out in Fairfield.
The police is meant to be there to protect and serve, the community. But I personally don't think that the community feels that way anymore.
Suburban streets were also in the spotlight. Highway patrol cars left little room. 5 officers dropped into this donut shop at Warwick Farm.
It is a bit daunting at first, but I do understand where they're coming from. It's important that we all do the right thing.
The operation was supported by community workers handing out free masks, armed also with a strong message.
Stay home if possible because it's still lockdown.
Police insist they're just doing their job and that this operation is comparable to the one that took place when there was a major outbreak on Sydney's northern beaches last year. But some members of the community here in Liverpool feel they're being unfairly targeted.
Only because we are a migrant here, I see it as discriminating against us. Why this has not happened in the eastern suburb?
I do understand that the Premier's gone to great lengths to reassure people that the same response happened, but I think it's been treated very differently.
But in a city where concern is shifting rapidly from east to west and now even south, the next deployment could be anywhere. Mark Reddy, ABC News, Sydney.
So let's take a look at how we stand tonight. As we've reported, the number of new cases is the highest figure for a single day in this outbreak, 44. Now, as you can see, these daily numbers have been bouncing around a bit during this lockdown, but they've clearly been trending upwards. In total, more than 430 people have been infected since the middle of last month. Tonight, 43 patients are in hospital. 10 of them are in intensive care and 4 are on ventilators. Of those people in ICU, 1 is in their 20s, there's another in their 30s, 3 people are in their 50s, and the rest of them are in their 60s. For weeks, authorities have been pleading with Sydney-siders to get tested. Cayman Gock is at a pop-up clinic in Fairfield. Cayman, how are people responding to the call-out?
Well, Jeremy, more than 42,000 people got tested yesterday, but that's not enough. The state government wants to see at least 45,000 people a day, but this will be encouraging for health authorities. I'm at a testing clinic in Fairfield, which closes at 10 o'clock, and there has been a steady flow of cars queuing up to get tested, with people heeding the health advice. Now, in some breaking news, there has been an additional 30 new exposure sites added to the health website, and they include several pharmacies as well as the Wetherill Park Medical Centre and the Speed Medical Practice in Liverpool. Now, if you've been to either of those places on Wednesday, you could be a close contact and must isolate and get tested immediately. For more information regarding these exposure sites, you can visit the health website. Jeremy?
Cayman Gock, thank you. Let's bring in Rani Hayman now at Bankstown. Rani, it's been a challenging few days for everyone. How's the community there holding up?
That's right, Jeremy. There's been mixed reactions between community leaders here at Bankstown and members of the public in response to this New South Wales police operation, which has ramped up in southwest Sydney. Some people say they believe they're doing the right thing and following the rules, but they feel like they're being unfairly targeted, while others think that the police presence is warranted and they believe it could help with non-compliance in the community. But the main concern that we're hearing from community leaders here is around messaging, so getting that health advice to different pockets of the community.
Southwest Sydney is made up by an ageing population and people from a cold community. These people don't use social media as a form of communication, so they still prefer personal phone calls or mail outs. I don't think enough's been done in that response.
So, as Sue Hamdouche said there, the main effective way of communicating between the state government and the locals, the residents who live in these communities, will be through those different forms of communication, and it is hoped that that will be a vital tool that's used to combat this COVID pandemic. Jeremy?
Ronnie Hayman reporting.